and she's also there to support me with IT, as in the first workshop I couldn't make my slides work. So thank you for that support, and welcome everybody. Nice to see your initials, if nothing else, and a few faces. So I'm just going to give you a bit of background about what we offer as an organisation. I work for Contact. I'm the early years project manager now. So we are a project funded by the DFE, and we are offering parent workshops and practitioners workshops for the early years settings and people that work in this early years area. And I've been asked today just to do a bit about Contact, and then hopefully moving forward some discussion about how you are supporting parents, families, parent care forums in your area. Oh, let me just try again. Here we go. Okay. So if you don't know me about Contact, it is a really fantastic charity that supports parents and families. So do spread the word if you're working with families. There's so much information. It really is the place to go to learn anything. Advice and support, there's helplines, there's a fledgling, which is the online shop as well. But what I will give you at the very end of the last 2 or 3 slides is all the links to all the different bits of helpful information that you can share and pass on to anybody that you feel it would give value to. And workshops we're running at the moment are all online. We've changed everything to online, obviously, the new way of working, the new normal, which again we talked about in our last workshop about how the positives of that are, as well as some negatives as well. So there's also, as an organisation, we do a lot of campaigning, volunteering, fundraising, and we support parent carer forums, and we'll talk a bit more about parent carer forums shortly. Our offices are in London, but we have support all around the country, and there is so much information that actually, when I show you later, you'll see exactly what I'm talking about. But there's a lot of information, is particularly at the moment, which is really important, is family finances. And there's a service which can support families through this maze, especially while things are quite tight for so many families, with a lot of redundancies and unemployment going on at the moment. So yes, do look it up and do send on that information. So my personal experience through COVID was very mixed, actually, and it's not all bad. I think we only tend to hear the bad stories, but both my husband and I weren't working. We lost our jobs. We couldn't work. We both worked from home, so we weren't able to work. And so we went to work for Sainsbury's. I packed shelves, and my husband does the deliveries. And that meant that we were key workers. So my son got 3 days at special school. As you can see from the picture here, he's got the most amazing smile and keeps us all happy. But Fergus is non-verbal. He's gastrostomy fed. He's in a wheelchair. He has to have 24/7 support, doubly incontinent. So he needs 24/7 around the clock care, basically. So the fact that he was at school 3 days a week, we were really lucky. And also we got transport. So a win-win situation there. We didn't have school over the Easter holidays, which again was fine because we knew that we were lucky enough to get those 3 days in term time. Absolutely no short breaks whatsoever, as everybody else. They are beginning to come back to normal, well, whatever normal is now, but we are getting a bit more of a break now. Or short breaks are running back in Hampshire, which is where I'm based. And all our PA stopped working for us. So I used to have some help in the mornings, getting him up, getting ready for school, or whatever it might be, and then doing bath time at night and putting him to bed. And also for the days, the days were very long. We managed to get out and do a walk once a day, but that was all he had, and a lot of CBeebies, I'm afraid. The positive for us that I actually was involved with the BBC interview about our family and how lockdown had hit us. And because of that, not very nearby, but I live in North East Hampshire, and a Southampton respite provider rang me and said, would I like to have some respite? Now, we'd always fought against being so far away from us, but we were so exhausted that we said yes. So I now have monthly respite. So that's one of the real positives for us as a family that's come out of lockdown. We then went back to normal, sort of normal. Fergus went back to school. But then my older son tested positive about 3 weeks ago. So we then had to go into 14 days isolation. So we were back to where we were again. no care, nobody coming in to help. Fergus back at home again, and I now work. So and I'm working from home, and I'm working pretty much full time, and so it's meant that poor Fergus had 14 days pretty much of CBeebies. I was exhausted trying to juggle him, trying to make sure that he wasn't too bored, and trying to work at the same time. So it's been a really mixed bag for us as a family. But as we know, and I'm sure the fact that the parents that are on this call now know that there are so many exhausted parents, totally socially isolated. I don't see any friends anymore, and Fergus doesn't get to do an awful lot. So we are pretty much socially isolated. I worry about him. I worry about whether he's going to catch COVID. I worry about the rest of the family having experienced one session of social isolation. I don't want to have to go through that again, and to go to level 3 for us would be horrendous. Again, if things do change and we have another period of isolation, then school, and again, what all those families at the moment that are worrying about whether their children should go back to school, whether they shouldn't, whether and so many classes are closing, and so because one child has it, then the whole class are having to be sent home. We're all juggling childcare and trying to work, and those that are working. And with the workshops that I'm running at the moment, I'm talking to so many families and parents who have got huge problems. Their mental health is deteriorating, as are their children. And again, financial pressures, they're always there. And no therapies. Fergus, in the short time he's been back at school, he's having physio again, but he never had that during lockdown, or OT or anybody else coming in and supporting him. So he's probably regressed in terms of his health for that. And we worry about the siblings, with the sisters and brothers. I have 18-year-old twins. One's just gone off to university, thank goodness, although she's spent most of her time in her flat, I think, at the moment. But the other one's here, and he worries about what's going to happen to Fergus. He worries about himself. It's the whole family that we need to think about. As I say, Contact have reacted to COVID, and there is lots out there. One of the new things that we have introduced is the new one-to-one listening ear, where parents can book appointments throughout the day through Eventbrite to have a one-on-one session to talk about sleep, well-being, food issues, whatever it might be. There is a lot of support out there for families. And it's regularly updated. The COVID-19 web pages are regularly updated. And I think some of the time there are a lot of parents that don't know how much information there is out there, and it's making them realise that there is probably a lot more, in fact almost too much sometimes, if they know where to look. So those that are working with or are in parent carer forums, those that don't know what a parent carer forum is, it's a group of parents that come together to work alongside the local authority, health, fire brigade, whoever it might be, who want to understand what it's like to have a disabled child and what services could be improved or could benefit by working together co-productively. And part of Contact's job is to support the forums in their operation, especially with their grants they get from the DFE. So they're really important, especially at the moment, and we'll talk about in a minute, as how you're working with your parent carer forums. And there's a national umbrella organisation, a national network of parent carer forums. In fact, Tina was on the last workshop, so we had her input, which was great. But the idea is that they also influence national policy and legislation, whereas the parent carer forums in the local authority areas hopefully influence and work alongside the professionals in that area. But they're tired. The parents that are working in the parent carer forums at the moment are exhausted, because not only do they have their jobs to do with working with the forums, they have their challenges at home as well. And I think so many of them have stopped. I mean, I know there are quite a few forums out there at the moment who have had to cease working, and or some of them are just starting up. And of course, this is not a great time to start up a forum at the moment. The people that run them are exhausted, and there's less people working in them because they have issues at home and they cannot do anything to help. So I think many of us are probably meeting fatigue. We're probably all had a bit much of Zooms, followed by Teams, followed by GoTo. But it has to be done, doesn't it, really? And if we're going to carry on co-producing with the local authorities, then we need to make sure that we can attend these meetings. But those meetings might have children, all sorts of things that are entering into the video conversations as they're going on. And then again, we have the issues of further lockdowns. So I think some of the discussion we've had in the previous one was really interesting, actually, is how the local authorities and professionals are actually reacting to parent care reforms at the moment. And some of it's been really positive, actually, listening to how some of the professionals are working now with the people that are running the forums. I think it's just being a bit realistic, and I think it's everybody understanding what life is like at home for a lot of the families, and therefore meetings at different times of the day, or maybe even in the evening sometimes, is going to be a better way of working. And perhaps looking for quick wins, working with the parent care reform to think, okay, how can we engage quickly? How can we speak to parents? Let's not do an hour-long Zoom meeting. Let's do a dip in and dip out. Maybe it's a Facebook survey, or it's a quick survey here and there. But again, there are so many surveys out there at the moment. We are a bit over-surveyed as parents. So this is just a quote from a parent care, really, just saying about how wonderful the work that Contact is. There is no single person from official authorities to help families through the maze of support and tell us what we need to know. Contact covers that niche and helped us get back on our feet and enjoy being a family. And at this particular moment in time, what we need to try and remember is actually we want to be a family again, and we want to think about what the new norm is going to be. Just some very quick information here. You know, we are there to support families, and we have supported them the last year. That 96% of families feel better informed, they're less isolated, they're able to deal with stress, more confident. So there is all that information there to help. And these are all the links to the different areas. I'm not going to run through them, but they're here. You can get the slides, you'll be able to click on and send all this information to your parents that you work alongside or with. So please do spread the word, because there is so much help out there. And that is the end of my presentation, to try and hopefully get some chat going with everybody. So there we go. We're back to seeing faces and initials. So certainly for me, one of the positives, many positives that I had over lockdown, was that Fergus had his annual review, and I refused to have Fergus's annual review without health, social care and education being there. And there is no excuse, because there's no travel problems. If you do it well enough in advance, you can get everybody sitting around a table, a virtual table. So that for me, and I had a really good annual review with him. That was a real positive that came out for us. So do feel free to put your hands up or to put some questions in chat, and Lisa and Charlotte and myself will try and facilitate those between us. I do have some hands showing. Yeah. Let's have a look. Kay. Hi, Kay.
Hello, Gail. So yeah, I just wanted to really flag up around the PFA information that's on the Contact website. So National Network of Parent Carer Forums, NDTI, Contact and Carers UK did a bespoke piece of work earlier this year before we went into lockdown in terms of preparing for adulthood. And that was part of a project funded by Department for Health and Social Care around their Carers Action Plan. So I just really wanted to, I know it was on your slides with it's mentioned there, but I just really wanted to promote that because it's a really good piece of work. And having just come out of the PFA workshop earlier this afternoon, I think we all recognise that there is so much more work to be done in that area.
Okay, thank you very much for that, Kay. Brilliant. Samantha, Sam. You had your hand up, Sam, is that right?
Yes, I was just trying to find the mute button. I'm taking this as an opportunity just to share what we've all been doing so we can learn from each other.
Yes, please. Top tips.
Well, I don't have any top tips. I suppose I've been in a very, I didn't understand that it was fortunate at the time. I'm I'm a strategic send manager for the council, but I'm a joint post, so I'm also the designated clinical officer for the CCG. So I've got 2 hats. And our parent carer forum folded at the end of last year, which felt really difficult. But actually, the new parent carer forum that has been facilitated by Catherine Ratcliffe from Contact has been really, really positive, because it's enabled us to start afresh, if you like.
Yeah.
So we have we're taking it as an opportunity to actually refresh professionals' minds about what co-production is. So we're co-producing some training with the Parent Carer Forum that will be delivered to the SEND board to start off with, and then cascaded down to team leads, because the way that our previous forum had built up a way of working was that if you invited them, people would tick in the box to say, yep, it's co-produced, I've got somebody from the PCF here.
Yeah. And
that it wasn't. It was it wasn't true co-production, although we did do some good things. We've got SEND updates now that are being co-produced between what parents and carers find useful. And one of the most terrifying things I've done is I did a live Q&A
Wow.
with parents and carers. I've done 2 now, and found it was quite challenging to start with, because you get the questions in advance, so you know, but obviously when you're in the meeting, then you can get far more. But it was really helpful as a sense check, and it was facilitated by Catherine from Contact, and that's now going to get typed up and put on our local offer. So, and I'll probably do a couple of those across the year, so that people get to actually speak to a person rather than having to write in a letter, and get a personal response if they're on the call, and then it's all written up afterwards.
Yeah, that's a brilliant idea. They do those down in Hampshire, actually, where I am. We started those off a couple of years ago with the head poncho of education, and she bravely said yes, and has worked really well, because I think parents want to see faces, and you know, they all think that these people sit in their ivory towers, but they're actually human beings, you know, and parents need to know that you are all human beings too, and that you want the best for us, really. So that's a really good idea.
There's also something about how the system works.
Yeah, absolutely.
It looks quite impenetrable from outside. And then the other thing that we did was, over the summer, we co-produced a understanding the impact of COVID-19 on children and young people and their families with SEND. We co-produced that with the local, with the Parent Carer Forum, and we based it on the national one that was done by the Disabled
Children's Partnership. Yeah.
And we got our biggest response ever. We got 426 replies. Wow. People had a lot to say, and it's given us some really rich information about how they want things to be moving out of COVID. That has been, it's one of the best things I think that we've done.
Yeah. Fantastic.
So that's.
Thank you so much, Sam. That's some really good hot stuff there. Really good. Beverly, you had your hand up.
Yes, just on that point about understanding that people who work for local authority are humans, but also people who work for local authority take our lives for granted, that we're available for work, that we're not exhausted, we're not isolated in the same way, that kind of thing. So I just found your description, Gail, really poignant. And as you know, in East Sussex, we have a fairly new forum, and it's been sort of a long time in the making, as it were. And so we had all these things that we were destined to produce, all stacked up, and then we fired it to them. You know, we want you to do this. And I think that, you know, we need to stop and think, you know, well, what are the expectations? What's reasonable? And exactly the things that you're saying about the time of day, the length, the digital ability of people to work in the way that we're all used to, and basically just to be kinder to them, because if we don't nurture them, we're going to lose them, aren't we?
You're absolutely right.
Back to square one again. That's all I was going to say.
Yeah, I mean, again, in my experience of 16 years of having a severe disability, I've never met a professional who doesn't want the best for your child. The problem is it's the finances around them that actually is the problem, and their hands are tied. But if you know that, if I know and somebody comes to me, well, I'm sorry, but I can't give you the chair that you want because there's no money in the pot, I understand. So it's just that whole transparency and honesty that I think parents respect than don't really. But yeah, no, thank you for your words there, Beverly. Anybody else got anything to say? I can't believe you're such a quiet bunch. Oh, there's a hand up. Ella. Hi, Ella.
Hi. Just wanted to say that some people that work in local authorities are also parent carers, like me, like Kay.
Absolutely. Yeah, absolutely.
And so, yeah, very committed to the cause, but it is difficult work, definitely. So we've done a send newsletter. I've started doing that here. I do our local offer. I'm not a strategic leader, a decision maker, but yeah, we've started doing a send newsletter, and we changed the format of that to suit the parent carers, and they've been sharing that. We've made it more easy for them to share digitally. We don't have social media for the local offer, unfortunately, although I keep trying to argue for it. What else have we done? We did a Q&A with them, but it was quite difficult because the questions they sent in advance were very detailed and about very individual cases that when I followed up were being addressed. So that was quite difficult. It would have been great to have that facilitated by a third party. Yeah, and we would do that again. We've got parents on working groups. I've got parents on my steering group, so I would consult with them about what we're doing. But I agree, there's an awful lot going on. There's an awful lot of expectation for parents, and I think maybe if parent carer forums haven't been putting on events and doing things, that may be allowing them to spend money on technology that allows them to interact more and to provide them with some really good training on that's helpful to them, would help the co-production process. Yeah.
Well, interestingly, actually, we have just signed off a workshop for parents and care and for professionals, I guess, really, but actually more for parents, is meetings and how to handle an online meeting, how to look, how to call, how to behave, top tips on that. So they are in our workshop in November. Do tell your parents to go. They're free meetings.
Where will we find out about that? Because often we would love to share that kind of information with parents, but where will that be shared? In the CDC newsletter?
It will be, but also on these slides, all the 2 final slides have got all the links to all the information that your parents will need, including the workshops, and they go onto the right page, and then they can choose which workshops they want to attend, and they're free. At the moment, it's this DFE funded workshops until the end of March, so make the most of them while they're there, definitely. Hopefully there'll be more funding, but who knows with the DFE. Thank you very much for that. Kay, you got your hand up.
Yeah, I just wanted to mention something that we're doing in Bromley and have been doing throughout the lockdown. We were having weekly issues meetings with our Parent Carer Forum, but we expanded that out then to include our information advice and support service and some of our other voluntary sector partners who obviously work closely and support families with children with SEND in the borough. And that's worked really well because that's enabled us to pick up issues really quickly and deal with them, and to have a two-way conversation really, and to make sure that the communication was there for families when they really needed it. So an example is we've just picked up about the increase in requests for education at home, elective home education, and as in response to that, we revisited our information that was on our local offer, because we felt very strongly that parents were making that decision without perhaps fully understanding the implications of it, just because they felt that the pressure was off a little bit while their children were at home. Perhaps their children and young people were more settled, learning in the home environment, and that felt less stressful for the family as a whole, without fully understanding what it means in terms of the support that would be available to them. So that was one piece of work. The other thing I just wanted to mention, which is really something that's really passionate to me on a personal level, is my son is 24, and there, quite rightly, there has been a lot of focus around children and young people in education and returning to education. But just to flag up that there are a group of young people that are under the age of 25 who currently are not in employment, education or training, and therefore they are not having their needs met necessarily in an education setting, and therefore their mental health and anxiety is a real concern, as is their parents, who are having to continue to support their needs, and without any access to support anywhere, really. So yeah, I just wanted to flag that.
Brilliant, thanks, Kay. Carol Kelsey. Hi, Carol. Put your hand up.
Right, I'll put my camera on briefly. I'm not keen on always being on the
Don't
screen.
be shy. Hi, Carol. I know who you are now.
Just to sort of say that we've sort of used some of our funding now to buy GoToWebinar, and what we've been doing is having regular meetings with our reps. So even though some of them haven't been able to take part in the work streams that they were because they've had children at home and family circumstances, we've been able to keep them updated. And also because we get some money from our local authority as well as the DFE, we have members of staff who, that's me, I do two things, I'm a member of staff and I'm a rep. And so we've been able to substitute, we've used our time to substitute for reps where they're not able to, so that we've always managed to maintain a presence, because we're lucky in that we've got that extra funding. We've also developed, so we're also able to keep our reps informed, but also sense check with them what they're hearing on their networks, because obviously we've got lots of informal networks on social media. And then we started about 18 months ago, we started something we've called involvement partners. So we have key voluntary organisations in the county. So Hertfordshire is really big. It's really hard for us to cover it physically, even when we're allowed to. And so we've been involving them in sense checking what the issues are that parents are bringing to them. And the local authority invited us to come to their weekly operational Send COVID type meeting. So that has involved not only Send officers, but also officers from other bits of the local authority, other parts of education. So for those officers, it's been a bit more unusual to have a parent there. Not all of them have been particularly receptive. However, the assistant director is insisting that we show up, and we've really been able to communications and getting things quickly onto the local offer. So one of the examples was, as soon as the face mask issue came, we had loads of communications. Oh, my child can't wear a face mask. Within 24 hours, we had a page on our local offer about face masks, with various things on it, and that has had something like over 45,000 hits, something like that, on that one page. Plus, we've also got them to think about the messages they were putting out to non-Send parents, because we've got the same queries and they weren't necessarily doing that well on the main council site. So there's been some crossover benefit of having us there, I think, because not all of the issues are exclusive to Send parents. So that has improved some of the information they've been getting out. And plus, we've been saying Send parents tend not to look at the ordinary bit of the council website very much. So we need to double message. You put the same message in sort of two places. So I'm not saying that everything's wonderful, but we have been able to keep going by thinking sort of about it slightly differently and using our funding differently. So we are spending more on staff costs because we've got more organising to do and more pulling the information together and feeding it back, rather than it being done in a meeting and someone else from the local authority goes away and writes the notes up. Yeah. Some of that's fallen back onto us. Yeah.
Thank you for that. Gosh, lots of rich information there. I mean, interestingly, one of the things that came up in the last group was that parents don't always have the technology. I know there is evidence somewhere, and I've read at one point that most people now, huge percentage of people have a smartphone. So there is a way that they can access information. But also Family Fund have got some more government funding, I believe, that can support families to get an iPad or a tablet or whatever it might be that they want. So there is funding there for some families. So do remember that as well for your families.
Yeah, and I think we have pushed that with the local authority really quickly, because schools were sending, PDFs that needed to be printed out, and loads of families were saying we haven't got a printer, or we can't afford the ink because the ink's quite expensive.
Yeah.
So we fed that back to our local authority to suggest that schools send out PDFs that could be filled out on a device as opposed to having to be printed out and things like that. And I think the data issue, it's not only about having a device. You've got to have enough access,
absolutely,
to data and to having suitable Wi-Fi at home, etc. So we've been trying to support our parent reps with that. We have a very high percentage of households with access to the internet in Hertfordshire, just because of where it is and what it is. So we haven't had as many problems as other areas. But I think you're absolutely right. The access to IT is a crucial one, particularly for families on low incomes, where there isn't £300 to go and buy a tablet, is there?
Absolutely. But also the positives as well for going through this whole virtual world we're in now is that this is one of the problems of parent carer forums and local authorities is accessing the hard to reach families, and those families that wouldn't necessarily attend meetings or come to parent carer forum meetings. Actually, this is a really good way to access them, because they can hide behind a camera. They don't necessarily want to be seen, but that's fine. We've had so many parents who've attended our workshops who would never have come to a workshop on sleep, who would never have come to a Money Matters workshop. And this is so there are some real positives that we are hopefully accessing different parents. And again, we're giving parents the choice of morning meetings, afternoon meetings and evening meetings. So there's none of that, well, we can't come to a meeting because we're working, or actually we're putting children to bed at 7 o'clock at night. So giving that difference of timing is also really important. It might not always please the head of SEND or the director of children's services, but actually, if they want to get some parents, this is a way to do it, is to do different times of the day.
Yeah, and our involvement partners, I've got 10 voluntary organisations who reported they've moved very quickly to delivering things online, and they've all reported that they're going to continue to deliver much more of their content online because loads more parents have been accessing it and able to do it. Whereas if you didn't have a car and you couldn't travel to the venue, then you're stuck to start with, aren't you? So I think there's some real positives for a lot of families about online if they can access the IT.
Yeah, absolutely.
I think just to pick up on what Angela said in the chat about lots of families being involved and wondering about the balance. In the previous workshop, somebody was reporting from health that families were really benefiting from the therapy that the children were receiving, and the contact from the therapist while the children were off school. So I don't know if that'll be useful information for you, Angela.
There was another comment as well, actually. I've just seen one about continuing care. Somebody who works in continuing care.
That was the same question.
Oh, was it? Oh, that was, yeah. Okay. Yeah, I mean, my son has continuing care, and actually having contact with people would be great. I have had no phone calls from anybody in health at all over the last, since March, to be honest with you, to make sure we're okay, apart from me insisting they were there at an annual review. I would quite like a phone call for me to say, actually, I'm okay, or actually I'm breaking at that particular moment in time. So don't feel that you can't contact families. They'll tell you if they don't want you to call.
Yeah, or not answer the phone.
Yes, exactly. Absolutely. have we got any more questions or any more information that we'd like to share? Any good practices? Had some lovely stuff coming out, so thank you for sharing.
Can I, Carol's, I missed that. I just wanted to have a look at her local offer.
Carol, she's Hertfordshire.
Actually, our local offer is, had you been looking at it 18 months ago, I wouldn't have recommended it. We've done an absolute ton of work on it, and it looks good, and it's improved no end. So I am proud of what the co-production that we've been doing on the local offer. It's not finished yet, but we've had a special project on it, and it's really improved a lot. And we do have something that's called the Send Online group. So with about 150 parents who they just send out saying, oh, we're thinking of doing this, what do you think? Or here's a new bit of information we're putting up, does this look right to you? So that people are able to just spend 10 minutes at home feeding back. They don't need to go anywhere. So that online group's, yeah, it's got over 150 parents. So it's up to you whether you...
Sorry, Carol.
Yeah.
Where's that hosted, the online group? What do you host it on?
Well, now you're asking me an IT question, aren't you? The local authority does it as part of its local offer work. So they keep the contact details, and then exactly how they do it, I don't know. I mean, we've got people in it who are part of the forum, but any parent can join it, and then it's up to them whether they respond when they get a message or not. But they usually get about a quarter to a third of people responding.
Wow.
Which is, quite good. So they're getting 30, 40, 50 people coming back about something that they asked for feedback on.
Great.
Which, is really helpful, and people can just do it. It's just a 10-minute job. You can do it whenever you want.
Thank you, Carol, again.
I was just trying to type in the chat. Oh, it's probably quick for me to say it, but quite a lot of families have reported that with the extra phone contact they've had with professionals from, say, social care or wherever, it's actually improved their relationship with people, and the professionals' understanding of their family is improved as well. So I think that there are some other positives.
There are lots of positives. Sadly, we only hear the negatives, don't we, most of the time? But there's some really good feedback there. Ella, you had something to say?
Yeah, I had a query from someone, and I did have a look on the contact website, but I couldn't find it. And it was about parents that split up, and how if their child requires equipment, whether it has to be provided for each parent, if it's expensive equipment.
Good question.
And I guess, if families who have difficult situations are more likely to split up, we know that is true. It must be a common situation, but I spent quite a while yesterday trying to find information on it, and I couldn't really find any without going through the whole Disabled Children's Handbook, some of which I don't understand.
I can speak from my personal experience. When my daughter came out of hospital and required equipment, it was only provided to myself, not to her father. Now, I suppose it would depend on the equipment and who and your area and lots of things, but I don't think it's standardly.
It might be worth going through the family fund again, possibly, for extra equipment. It might be worth asking that route.
Recommended, sort of looking at charities.
Yeah. Okay, thanks, Lisa, for that. Siobhan, I think that's you again.
Yeah, I had two things to say. One was just on the equipment, and it's great to see that you and Sussex provide it for two lots of families, because we really, really struggle with that. I work in Cambridgeshire, and it's the OTs and the equipment store are only commissioned to provide for one, and it is really tricky, isn't it? We have the same as well. Sometimes kids who spend time with linked foster carers getting the equipment to enable them to have an overnight short break somewhere. But I also wanted to echo, I work in social care. I'm not a social worker, but I do work in those teams. We have had loads of feedback as well from families about saying that the relationship that they have with their social worker has been much kind of richer and more supportive, partly because they've been able to have longer conversations. They don't feel that they're getting visits sometimes that feel a little bit, what's the word, intrusive, excuse me, intrusive, or sometimes even not that necessary. So that people have really liked that. But now that we're back doing face-to-face visits, people are much more getting a balance on, do you want a visit, do you want a phone call, do you want to do it on Teams or Skype or whatever, and being much more flexible around, rather than just saying, well, we've got a visit because that's what we've always done. And people, so we're trying to learn the lessons from that going forward.
Great. Thank you for that. Another comment actually came from Angela regarding 2 lots of equipment, was also try approaching your CCG. Worth a try.
Yeah.
Thank you. How are we doing for time? We're okay. We're okay. Anything else anybody would like to say?
I can just share about the wellbeing bags that I did in the other session.
Oh yes, okay. yeah, do.
So some forums are producing wellbeing bags, or even some voluntary organisations and local authorities are providing funding for wellbeing bags for parent carers and the families. So mindfulness things in there, wellbeing things, sensory toys, different things that will help through these times to be less isolated. And also just popping in information. You can pop in information about your parent carer forum, like local offer, things where, so families can know where to go to find out information, to not be left alone in these various lockdown situations.
Yeah, a couple of the forums shared that last time, didn't they, in the last workshop, and said it had really positive feedback.
Yeah. I mean, I'm also chair of a forum, and we've done it in the area I live, and it's really, really positive getting the feedback from families. It's been really difficult reaching out to families because everybody's kind of shutting down because they've got children at home, family sort of circumstances have been strained. But when you're giving something, people are really open at coming back and engaging, and it's really nice to see some positive families feel supported through things like that.
Thanks, Lisa. Siobhan, you had another comment.
Yeah, it was just again to echo that. We had Action for Children, who were one of our providers, did that, and what families, they really appreciated it was kind of goodie bags for the kids and the parents. But they said what was really nice was that they just did it to everybody, and there was no, do you need it? Have you already got this? There was no assessment or anything like that. It was just, we get that it's really difficult, so we're trying to do something nice, and people, they really like that. It was a nice gesture.
Absolutely, thank you. I know, I think that there is a feedback form that we are encouraging you, asking you to fill out, and I think Marie has put the link in the chat, so please do that. But thank you everybody for attending and adding to the chat. It's been fantastic, some good stuff. I hope everybody's learned something to take back, to try in your areas. And do encourage your parents to come to the workshops, because there's some really good stuff there, and again, it just stops that isolation. Thank you, everybody. Click on that link. Don't go till you've clicked on that feedback link. They're watching you. Bye, Sam. Nice to meet you.
Bye.
Bye, Ella. Thank you. Have a good evening. Must be gin and tonic time soon, isn't it? I can feel coming on. It must be 6 o'clock somewhere in the world. Probably shouldn't say that, should I? It's probably a bit unprofessional of me.
Don't worry about it.
We probably all feel the same at 5 o'clock, nearly 5 o'clock. That's great. Hopefully there's some good stuff there, Charlotte, again for you for the recording. You're on mute, actually.
I always do that. Yeah, definitely. I've got both sessions captured, so I'll drop Marie and Daphne an email as well about the 11th.
Great.
And I can just confirm everything with you for that. But I'll stop recording now, actually.
Great, thank you.